Parenting is a tough job, the toughest many of us will ever do. When our kids behave out of the ordinary, it's natural to wonder whether it's just a phase or something more. And our concern for their mental health should be just as important as our care for their physical well-being. Despite every parent's best intentions, some mental health or substance use issues will lead to a crisis. And when it significantly interferes with a child's ability to function, and it's severe enough to place the child or others at risk for harm, intervention is warranted.
It can be frightening and difficult to know exactly how to respond to a crisis. In fact, even law enforcement and other emergency personnel can be unsure how to effectively handle mental health crises. That's why Life Management Center's mobile response team is here to partner with them and with you in these critical situations.
Your local mobile response team was created in response to recent tragic school shootings. Our team provides on-demand intervention services wherever a behavioral health crisis occurs. We may be called to respond at the child's school, home, or anywhere a crisis occurs. When responding outside of a school, we will be accompanied by law enforcement for the safety of all. We serve anyone in need, focusing on those between age 3 and 25 in Bay, Calhoun, Gulf, Holmes, Jackson, and Washington counties. Our goals are to help with emotional crises, divert individuals from ERs and the traditional court system, and prevent unnecessary psychiatric hospitalization. We're also here to help you identify potential crises in your children before they occur. Simply call Life Management Center's mobile response team anytime, day or night, and a behavioral health professional with specialized training will assist you, either in person at your location or through an online assessment depending on place, time of day, or if it's a weekend. Once on site, our first job is to evaluate and assess the individual, then make a safety plan for him or her and any others who may be affected. We will also follow up with you as your child begins receiving treatment to make sure the services are appropriate and answer your questions. If we can't make an effective safety plan or otherwise address the situation, mobile response team professionals are trained to help initiate a proper Baker Act protocol. We'll get back to the Baker Act shortly.
For many parents, the idea of suicide is the worst possible outcome of a child's mental health crisis, so it's important to know the warning signs. Here are some things to look for in 3 different areas. The first is talk. Does a child talk about being hopeless or feeling trapped? Does he or she ever talk about killing themselves, even jokingly? Second, you may notice behavioral changes, like substance use, acting withdrawn or isolated, unusual aggression, sleeping too much or too little, or saying goodbye to friends or family and giving away possessions. And third, pay attention to mood changes, like depression or anxiety, and feeling irritable or angry. The child may seem uninterested or feel shame, but they may also show sudden relief or improvement for no apparent reason. It's also good to know what's true and what's not true about suicide. Jeff and I will address 3 of the most common myths. First, there's the idea that if you ask someone if they're thinking about suicide, you'll encourage them to go through with it.
Actually, the opposite is true. And asking about suicide can lower a child's anxiety and give them an outlet to talk to you or someone else.
Another myth is that suicide usually happens suddenly, with little or no warning.
Studies consistently show that people who are suicidal will generally give many clues and warnings about their intentions. If we know those signs, we're more likely to be able to help.
Many people also believe that a straight-A student or one who's active in extracurricular activities would never think about suicide.
The truth is that anyone can suffer from mental health or substance use problems that could lead to suicide. And if your child or another individual is threatening suicide, initiating a Baker Act may be the best choice.
Let's learn more about the Baker Act. Passed into law as the Florida Mental Health Act of 1971, the Baker Act allows people with mental illnesses to be held involuntarily for up to 72 hours in a mental health treatment facility if they're believed to be a danger to themselves or someone else. This can be initiated by judges, law enforcement officials, doctors, or mental health professionals.
The mobile response team is always available to explain the Baker Act in detail to parents and other caregivers. Here are 3 basics we believe everyone should know. The first criteria for a Baker Act is that without treatment, the person is likely to suffer from neglect or harm to himself or someone else in the near future due to mental illness. Second, there doesn't need to be imminent danger. Just the talk or threat of a future action like suicide could be enough to warrant a Baker Act. And third, the person does not need to be held for a full 72 hours. If they've been examined and it's been determined that they're no longer a threat to themselves or others, they may be released. Now, what does need to happen within 72 hours is one of three things. The patient must be released, checked into the mental health facility voluntarily, or approved for a stay beyond 72 hours through a court petition. The law does require that once at a receiving facility, children must be evaluated by a psychiatrist within 12 hours and adults within 24 hours.
Remember, it never hurts to have a conversation about your kid's mental health or substance abuse. So think of Life Management Center's mobile response team as an information resource for yourself, as well as a tool to link those in crisis to the services they need. If we can help in any way, please let us know.